As you progress through your pregnancy, you may have found that doing barbell hip thrusts just isn't an option. There are lots of pregnant women who do keep heavy barbell hip thrusts in their routine, but if you're like me, I just didn't feel good about it. So I quickly explored other variations. So let's talk about 3 options that you can play with to see what works best for you. Option number 1 is to do one-legged dumbbell hip thrusts. So with the one-legged dumbbell hip thrusts, you're gonna have a dumbbell and we're gonna roll it onto our thigh right here. We're gonna slowly, just make sure it's nice and stable, slowly come down on the bench, and you can keep it like this on your thigh. I find the barbell across my thigh, it just pinches and it's very uncomfortable. So I'll actually tilt it up like this so the dumbbell is standing. I find that to be way more comfortable. So I'll grab onto one side, use the other hand to stabilize things. So obviously, whichever side the dumbbell is on, the other leg we're going to elevate. You can keep a slight bend in your knee, or you can completely straighten your leg. A more straightened leg is gonna make it more difficult. So do whatever works best for you, okay? So I'm gonna keep a slight bend in my knee. We're gonna come down, we're gonna breathe in and then breathe out when we come back up, okay? We wanna keep our gaze forward. We don't wanna hyperextend by looking up at the roof. This instantly puts my back into an anterior pelvic tilt, which is not what we want. We wanna keep that spine nice and neutral. So keep your gaze forward and just kind of focus on scooping your glutes. The only joint that really should be changing is your hip joint, okay? So we're coming down, we're scooping our glutes, tucking our chin, and looking forward. If you feel this too much in the quad, so I'll do the other leg, when you switch sides, just simply roll the dumbbell over and grab it like that. If when you do the hip thrust, you feel it too much in the quads, that's an indication that your foot is too close to your glutes. So I would bring it out ever so slightly. If you find that you feel it more in the hamstrings and not the glutes, that's an indication that your foot may be too far forward. Like I feel it instantly, my hamstrings right there. So you kind of want to have a 90-degree angle with your foot position, okay? So that is going to be variation number 1.